Well, it is beautiful outside, and everything that you've been waiting to do, pickleball, tennis, canoeing down the river, paddle boarding, all the summer activities, they are finally happening. But how do you have fun without getting injured? And what do you do if you feel a little twinge or even worse? Dr. Doug Goumas is an orthopedic surgeon at the New Hampshire Orthopaedic Center. He knows all about those aches and pains of common summertime injuries. So, doctor, let's start right there. So is there a pattern that starts to emerge when people get back outside? Do you see certain ailments pop up?
Yeah, so there certainly is. There are those acute injuries that are related to whatever recreational activity you might be involved in. So the one I like to always mention is that a lot of people in New Hampshire, mountain bike riders, we had our first casualty this week. Someone's mountain biking and fall out, off the handlebars, land on their shoulder, clavicle fracture, AC joint separation. So there's certainly different recreational activities that are associated with different types of injuries. If you're playing beach volleyball, you end up having an Achilles tendon tear is very common. More commonly nowadays, everybody's playing pickleball. So most recently, last week, 24-year-old guy, not certain at 24 why you're playing pickleball, but nonetheless fell, dislocated his shoulder. So there's those injuries, and then there's also those injuries that are more overuse related. So, first time out there golfing, elbow hurts, golfer's elbow, first time playing tennis in a long time, tennis elbow. So there are those acute injuries, and then there are those injuries that are more kind of overuse, and you haven't been doing much all winter, and then suddenly nice weather is here, and then that's, the overuse injury is very common. And preventable. They should have been prevented in the winter when you could have been working out and getting in shape. But nonetheless, when they happen, we see them and we take care of them.
I know it can be just one bad swing, right? And there you are in trouble.
That's right.
So injuries, of course, they can happen in an instant, anywhere, doing anything. But sometimes you might not know how bad they are, right? Like you try to get back up, walk it off. Yep. Hours later, your ankle's really swollen or your shoulder's throbbing. Yep. Do you wait it out or do you go have it looked at?
So I think that's a great question. I think in general, if you have an acute injury, right? So you're hiking and you twist your knee, you twist your ankle, and all of a sudden it's swollen, that's something that you should come see us for. If you're golfing and it's your first time the season, elbow hurts, a little pain, little swelling, you could certainly hold off on coming to see us immediately. And ice, rest, elevation, and do that first. And then if it doesn't get better over the course of a week or two, then I would certainly go see an orthopedic surgeon.
Yeah, I was going to ask you about that. So not everybody will need surgery, right? Like you just might need to rest your knee or whatever the case is. But what if you do need surgery? What does that process look like? How long after an injury, or what are you looking for? If you're going to operate and you're watching a patient, what are you looking for to tell you that this is the time I need to get in there and fix this?
Right, so in terms of the indications for surgery, right? So if you try conservative treatment, if I see a patient with a shoulder injury, we might do some physical therapy, anti-inflammatories to see how things go. If they continue to have pain, consider a corticosteroid injection. If things just aren't going in the right direction, the next step would be to get an MRI study, if we're using the shoulder, for example. MRI study shows perhaps a rotator cuff tear. If we decide to do surgery, that patient, the surgery itself would be an outpatient surgery taking about an hour or so. Recovery time, full recovery time could be 3 to 6 months. So again, a lot of patients this time of year, orthopedic injuries, it's really tough because the summer's here, and all of a sudden if your doctor says, look, you're going to need surgery, the last thing you want to do in the nice weather is finally here is to have surgery. So sometimes if we can put it off, we'd put it off until the fall. But oftentimes we can't. And if that's the case, the recovery time could take 3 to 6 months.
Yeah. How about if you're loosening up out there? You recommend a little bit of stretching before you get going?
No, 100%. But again, just to kind of reiterate, really, it's kind of late now. So the fall, the fall and the winter is really, when to kind of, make sure that you're in shape for the upcoming summer, right?
Yeah.
But if the time is here and you haven't done that, whatever activity you're going to do, I would approach it gradually, right? So if you're going to go play tennis, if you're going to play golf, don't go out the first day and play 18. You want to play 9 a few times and kind of work into it. because you will get these overuse injuries,
For sure.
which will happen if you're not careful.
Great advice, Dr. Goumas. A pleasure. Thanks for coming by.
Thank you so much.
Bye-bye.